Hello everyone, once again welcome to my Oet channel. After a long time I came here with a speaking card. We will have a scenario in asthma clinic. You see the parent of a 6-year-old boy who was recently diagnosed with asthma and now uses a reliever inhaler. The parent wants to discuss his or her son's medication. The child is not present. So this is the scenario. Read carefully the scenario because from here only you will get both introduction and conclusion, or else you will miss these 2 points. You will stuck over there at the time of introduction, also at the time of conclusion also you will have some confusion what to do. So you have to be careful when you are talking to a parent because it's a second degree talk also. So here, what is the thing you have to keep it in your mind? One thing, baby is not present, so no need to ask baby's name. And another one more thing, it is unknown scenario because you see the first task itself, find out the reason for parents visit. So it is a pure unknown scenario. Straight away you can just start talking. But the thing, when you will go to the task, you can see that you are talking to the parent regarding baby's condition and you are giving some more information regarding inhalers, different types of inhalers. But the patient is using only reliever inhaler, but you will explain regarding another types of inhalers also. So this is the overall idea. Just you will explain regarding the importance, after effects, how we can prevent after effects, what is the asthma, whether it is a curable or no. So these things are all it's going on there. So we will start the task. Find out the reason for patient's visit, parents visit. Find out more about child's asthma, any improvement, compliance with the use of a reliever inhaler, etc. Then we can start like this. Good morning. My name is Reshmi Rajan, one of the registered nurses working in this asthma clinic. How may I address you and how can I help you today? That's a simple way. Then the answer will be, good morning sister. My name is Johnson and I came here for my 6-year-old boy who has been recently diagnosed with asthma and now he is on reliever inhaler. Actually, I want to ask you some more questions regarding these inhalers and asthma. Then our answer will be, well, Mr. Johnson, I'm really sorry to know about your baby's condition, but no need to worry. I am here to explain you all your concerns. Then, before proceeding further, may I ask you one question? Then, after getting the permission, you can ask, could you please tell me that whether your baby got any improvement after the use of this reliever inhaler? Then the answer will be, of course, he is using whenever there is breathing problem and he is getting enough relief. Then we can tell that, oh yes, I am happy to know about that. Then our next task will be, find out about parents' knowledge of different inhalers like preventer inhaler. They have we got the information that patient is on reliever inhaler and they introduce another one named preventer inhaler. These two things you have to keep it in your mind. Okay. Now we can ask, well, Mr. Johnson, I would like to ask you, do you know exactly what are the different types of inhalers are present, such as preventer inhaler and along with this reliever inhaler? The answer will be, sister, I just know only little bit about this reliever inhaler. I don't have much knowledge about these inhalers. Then we can tell that, no need to worry, I will explain you. Then now we are differentiating between reliever inhaler and preventer inhaler. The task is, give details of preventer inhaler. It is a prophylactic, preventing inflammation of airway, regular use. Remind parent of details of reliever inhaler also. It is a reactive, reducing inflammation and swelling in airway, use as a required. So one it is regular use, another one is PRN use. That is only the difference. Both we are using for the same purpose only. So we can tell it's like this. Preventer inhaler means, from the name itself you can come to know that it is a preventing measures. It is a prophylactic one, preventing the inflammation of the airway, and the person can use on a regular basis, like according to the doctor's information, they can use it on a regular basis, once daily or twice daily, like that. And I would like to tell you the difference between the reliever and preventer. On the other hand, reliever inhaler is using once after the shortness of breath, once after the asthma attack. So it is a reactive one. and the action will be same. It will reduce the inflammation or swelling in the airway, but it can use as required. Whenever it is required, we can use. It is not intended for regular use. How does that sound? Or are you getting my point? You can ask, is it clear for you? Are you getting my point? Like that you can ask. The next task is emphasize the side effects of inhaled preventer medication, corticosteroids, unlikely. How low drug dose prevented by use of spacer, etc. Explain benefits of preventer use, like developing long-term protection. Advise on frequency of use of preventer inhaler twice daily, morning and evening. Find out any other questions and concerns. Either you can tell this twice daily, morning and evening, along with the preventer medication. You can tell in the previous task, it can be used as morning and evening dose as per the doctor's instruction. Then we can come to this point. Actually, this task is somewhat elaborated one. Many things are there. We can tell about the side effect. It is somewhat twisting also. So there are the side effects are very minimal, because if the inhaled air, if it is the medication, if goes along with the inhaled air properly, means there will not be any side effects. Only the effectiveness will be there. Effectiveness of the drug will be there. But as you mentioned that your baby is 6 years old, so sometimes he could not follow same your instruction. If he is not following the instructions, and if he is not following the correct method, means there is a chance for the low drug use. The low drug will be entered into the lungs and the effectiveness will be very minimal. But no need to worry, by the use of spacer you can get rid of from this after side effect. Spacer is a device you can connect with the inhaler, so that it will enhance the proper drug into the lungs proper. It will help to inhale properly the drug into the lungs. So that is the answer there. Developing long-term protection, so it will lead to the long-term protection. Once the complete drug dose, if it goes into the lungs, means long time your baby will get the protection. Then the frequency of use of preventive, already if you mentioned in the earlier task, no need to repeat it here. Then we can ask, do you have any more concern, Mr. Johnson? Then the questions will be, may I know whether asthma is a curable condition? So if you want to tell something negative way, you have to tell like this. Oh, Johnson, really I am sorry to inform you that this asthma is not a curable condition, but you have to tell the positive reassurance also. But no need to worry. If your baby using this, if your baby use this inhaler properly, and if he stay active, of course he can lead a normal life, same like others. But please try to make sure that your baby is using the inhalers in a proper manner. So like that we can tell. Okay. And I would like to tell you one more thing, Mr. Johnson. After 6 weeks, your baby will have another one appointment. At that time, please do not forget to get your baby as well. So that is the task. Then how we can conclude? We can ask, do you have any more concern? If there is no more concern, we can tell that, Mr. Johnson, I hope I have clarified all your doubts. If you have any doubts, please do not hesitate to contact with us. Moreover, I will provide you the leaflet in which different types of inhalers and the use, the method and techniques are given in picture wise. So it is very, it will be very useful for you to understand the techniques, as well as I will give you the pamphlet for asthma. You will get complete information regarding the asthma. Is it okay for you, or how does that sound? Like that we can ask. Then it will be yes. Then we can tell that, thank you for your visit here. I hope your baby can lead a normal life without any complications. Thank you. So that's enough. With that we can conclude. And in case of COPD, asthma, hypertension, diabetic, like long-term conditions, for long-term conditions, not like hemiplegia, stroke, CV and all, we could not tell a fast recovery or complete recovery, early recovery, nothing. We could not tell like this. We could not wish anything. So you can just tell that, thank you for your visit here. Meanwhile, if you need any assistance, please do not hesitate to contact with us. So with that, we can wind up the conversation. So I hope it is clear for you. Just practice hard with your friends. Always try to get friends in the Telegram group or somewhere, or your friends, your family, or someone. Just practice in the same way, so that you can make an improvement. So always don't try to practice with the simple cards. try to select and practice with the exam oriented cards. If you follow my Telegram group, I used to post these cards and writing task and all, so you can make utilize. Okay, in the description I have noted the link of Telegram group. You can make utilize. So we will see with another informative video. Until then, bye, take care.